I'm going to shift gears a little bit. At the Institute, we don't necessarily work directly with navigators, and there are far more expert folks in the room, folks like Daniela, Maura, Sheila, that are doing fantastic stuff around enrolling people. What I wanted to do is shift gears a little bit and talk about the context of what happens next. So as we're using the metaphor by the rabbi this morning around building an ark, as we're building this ark together, we have these wonderful craftsmen and craftswomen in the room. After we build the ark, where do we go? And so what I want to share with you is a perspective of what happened in Massachusetts. What Pete didn't mention is that I recently moved down to Florida, and I was actually involved with the Massachusetts health reform effort. For those folks that don't know, Massachusetts passed health reform in 2006, and the national health reform effort, the national ACA, was modeled after Massachusetts. And so we had this experience almost 7 years ago. So, how many folks have ever seen the movie Back to the Future with Michael J. Fox? Okay, great. So, those that don't know, Michael J. Fox plays a character. He's older in his life, and something happens, and he realizes he has this opportunity to go to a time machine and go back in time and change the circumstances or re-examine the circumstances of his past. Okay? This experience for me feels like Back to the Future. When the exchanges opened up on October 1, we had the exact same experience in Massachusetts. The phone lines were flooded. The website for Commonwealth Care was shut down. We had the exact same issues. So what I want to share with you is from that perspective and how we as nonprofits can position ourselves to really be ready to guide the ark after we've built it. After we've got everybody on board. Right now Massachusetts has something like 98% coverage, which is amazing. But then there became the bigger question. You got all these people in the system, now what? How do you improve their quality of care? How do you reduce the cost of their care? How do you eliminate the disparities? And how do you improve the health of the population? We won't have time to talk about all of those, but I do want to put out a call to all of you as nonprofits, because we learned from that experience.
They are available to provide